Infected hydronephrosis. The infective lesions are those of pyelonephritis, the essential lesion that of hydronephrosis, page 458. Perinephritis. Fibrolipomatous perinephritis. Fibrolipomatous perinephritis is the aseptic reaction of the perinephritis tissue to the lymphatic distribution of toxins from bacterial processes within the kidney. The earliest reaction found upon operation upon acute cases of renal infection is edema of the fibrofatty envelope. As the process becomes chronic, this edema is replaced by scar, binding the perirenal tissues to the fibrous capsule of the kidney and enveloping masses of dense yellow fat, very different from the normal, soft, white perirenal fat. This protective perinephritic reaction has little clinical interest, excepting insomuch as it markedly increases the difficulties in nephrectomy for old renal infection. In ancient cases, it envelopes in a thick mass the kidney, the pelvis, the ureter, and the pedicle, and in some instances it even replaces the kidney tissue itself, so that the line of demarcation between kidney and perirenal fibrolipoma is but a thin line of scar, which is all that remains of the kidney capsule. Figure 69, perinephritis, Morris. Dense fibrolipomatous perinephritis due to intrarenal suppuration. The probe shows a fistula through which the suppuration has extended to the perirenal tissue in spite of the protective inflammation. Suppurative perinephritis. Although clinically the distinction cannot always be made, we must recognize the pathological difference between true perinephritic abscess, i.e. suppuration within the fascial capsule of the kidney, and false perinephritic abscess occupying the retroperitoneal fat but originating outside of the perinephritic fascia, and more properly termed subdiaphragmatic or paranephritic abscess. True perinephritic abscess probably always arises from some lesion of the kidney cortex, though in many instances this lesion is not discovered. False perinephritic or subdiaphragmatic abscess is due to suppuration in the surrounding viscera or parietes. As already stated, the pyogenic cocci predominate in the pus. Thus, Miller found staphylococci in 12 cases, streptococci in 2, streptococci and pneumococci in 1, bacillus coli in 6, 2 were sterile. Not counting the sterile cases, this series shows 71% of pyogenic cocci as against 24% bacillus coli, quite the reverse of the statistics for pyelonephritis. The perirenal fascial envelope usually permits the suppuration within it to extend only through its open lower end. Thence, it passes forward over the ileum and even into the true pelvis. If neglected, it may burst into the intestine or the bladder or through the skin, or it may even pass upward through the fascial envelope and rupture into the pleura or lung.